Now let's discuss the heavenly star points of Ma Danyang, gallbladder 30, Huantiao, and gallbladder 34. Yanglingquan, GB30 is located with the patient lying on their side at the junction between the medial two-thirds and the lateral third of a line connecting the greater trochanter and the sacral hiatus. How to find patient's position: supine or better lying on their side, preferably with the hip and knee joints of the side to be needled, flexed, and the lower leg straight. Use pillows for a comfortable position. Reference points: the sacral hiatus and the lateral prominence of the greater trochanter. GB30 is located on a line connecting these 2 points, 1/3 of the distance from the greater trochanter. Needling 1.5 to 3 tsun vertically towards the genital region. The needle may reach the fascia of the obturator internus muscle as well as intermuscular connective tissue. Long 3 tsun needles should be used. Caution: needling is often painful. Needling can result in an electric touchy sensation radiating to the toes. This sensation is particularly common with sciatic disorders, and if GB30 is needled, 1 tsun inferior to its normal location. Actions, indications: opens the channel and the luo connecting vessels, alleviates pain, benefits the hip and legs, eliminates wind dump. Special features: meeting point with the bladder channel, Ma Danyang heavenly star point, important point for disorders of the hips. Removes obstructions from the channel for hip pain, pain in the buttocks, pain in the lateral side of the leg, sciatica, hemiplegia, atrophy of leg, numbness of leg, rigidity of knee. Resolves dampness and expels wind, urticaria, eczema, tonifies qi and blood, tiredness, poor appetite, loose stools, blurred vision. Can be used for damp heat in the anus, urethra, and vagina. GB30 was included by Ma Danyang, the great physician of the Qin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for cold wind and damp painful obstruction, pain radiating from the hip to the calf, sighing with pain when turning over. GB30 is unrivaled in importance for the treatment of disorders of the hip joint and buttock, whether due to traumatic injury, painful obstruction, stagnation of qi, or deficiency. Crossing point of gallbladder and bladder, a Ma Danyang heavenly star point, one of the 9 needles for returning yang. For all disorders of the hip, consider needle or moxa. For sciatic pain, down gallbladder or bladder meridians. Consider for lower back pain and groin pain. Helps a person's mobility. They can jump once again. The crossing of the bladder and gallbladder meridians at this point make it suitable for sciatica from whatever cause, and it is one of the most frequently used points for this. This reunion with the bladder meridian, which traverses the lumbar area here, also makes this a useful point to affect the lower back, as well as the lateral aspects of the body, which come into the energetic territory of the gallbladder. The usefulness of this point is reflected in the fact that Ma Danyang lists it as one of his 12 points shining bright as the starry sky. Now let's discuss Yanglingquan, GB34. Location in the depression anterior and inferior to the head of the fibula between the peroneus longus and extensor digitorum longus muscles. How to find? This point is best located with the patient's knee flexed. Use knee support. Palpate for the head of the fibula on the lateral aspect of the leg and hold it with the index and middle fingers in a tweezer-like way. Gliding distally with both fingers, the more medial finger will drop into a depression directly anterior and inferior to the head of the fibula, the location of GB34. Located on the same level but on the medial aspect of the lower leg is spleen 9, at the junction of the shaft and the medial condyle of the tibia. Needling 1 to 1.5 tsun vertical insertion between the tibia and fibula towards the interosseous membrane. Caution: deep peroneal nerve with deep needling. In some cases, also common peroneal nerve. The needle may reach the interosseous membrane as well as the epineural tissue of the peroneal nerve. Actions, indications: benefits the tendons and joints, opens the channel, alleviates pain, benefits the lateral costal region, clears damp heat from the liver and gallbladder, spreads liver qi. Special features: Hilsey point, earth point, Hui meeting point of the tendons, coordination movement, lower Hussey point of the gallbladder, Ma Danyang heavenly star point, major point for disorders of the tendons and musculature. Promotes the smooth flow of liver qi, so for hypochondrial, epigastric, and abdominal distension, irritability, moodiness, depression, sighing. Resolves damp heat in the liver and gallbladder, so for bitter taste, hypochondrial fullness, inability to digest fats, feeling of heaviness. Benefits the sinews, for contracture of sinews, stiff neck and shoulders, pain in the elbow, hip pain, sciatica. Removes obstruction from the channel, pain in the calf muscles, painful obstruction syndrome, and atrophy syndrome of the lower leg, swelling, pain, and redness of the knee, rigidity of knee, cold painful obstruction syndrome of the knee. The importance of GB34 in disorders of the lower leg as a whole is further emphasized by its inclusion in Ma Danyang's 11 heavenly star points, his grouping of the most vital acupuncture points. According to this great physician of the Qin dynasty, GB34 was indicated for swelling and numbness of the knee, cold painful obstruction, hemiplegia, and inability to raise the leg. The action of GB34 is not confined to the lower limb, however, and it may be used in the treatment of stiffness of the neck and shoulders and pain of the sinews in the elbow, for example, tennis elbow. In summary, GB34 may be used for pain, cramping, contraction, stiffness, and sprain of the sinews and muscles in any part of the body. GB34 is an earth point, Hussey antique autumn point, lower Hussey point of the gallbladder, influential point for the muscles and tendons or sinews, quiet courage point. This important point regulates the earth within the wood, and as such brings strength and flexibility. It is a special point for the muscles and tendons. Consider for every type of knee and foot problem. Excellent for improving articulation of the knee. Consider if the lower limbs are in spasm or are cold or numb. For mental disorders such as depression, irritability, anger, confusion, or emotional extremes. It is helpful for timidity and poor decision-making, or when the patient sighs a lot. For lack of coordination between body, mind, left, right, up, down. It can be effective for chronic constipation. Useful when the patient becomes frightened easily. Consider for lower rib pain, nausea, vomiting, or for a bitter taste in the mouth. Commonly used with liver 3.